Hello everyone, today we'll be discussing the anatomy of the shoulder region and the back muscles. The anatomy of the shoulder region and the back muscles. But before we do that, if you've liked our previous videos and tutorials, I would like you to support us by clicking the like button and most importantly, subscribing to this channel, and kindly leave a comment in the comment section. Also turn on your post notification bell for subsequent lectures. Okay, so let's go into today's tutorial, the anatomy of the shoulder region and also the back muscles. So this is going to be our objectives. We'll look at the muscles of the back and then also the muscles of the shoulder. So the back muscles, okay, we have two superficial layers or two superficial muscles, okay, and then we have three deep muscles or three deep layers. All right, so the two superficial muscles are the trapezius muscle and the latissimus dorsi muscle. The trapezius muscle and the latissimus dorsi muscle. Okay, so just follow my cursor. This is the trapezius. Okay, it's in the shape of a triangle. Okay, so start from here all the way there. That's the trapezius. Okay, it actually has three parts. This is the upper part, this is the middle part, and this is the lower part. The upper part, the middle part, and then the lower part. So this whole muscle is a trapezius muscle. It's a very superficial muscle of the back. The second muscle is the latissimus dorsi. Okay, this is the latissimus dorsi muscle here. Now we have three deep layers or three deep muscles: the levator scapulae muscle, rhomboid minor, and then rhomboid major. Okay, so this is the levator scapulae, this is the rhomboid minor, and this is the rhomboid major muscle. Okay, so now let's look at the superficial layers or the superficial muscles: the trapezius muscle and then the latissimus dorsi muscle. So for the trapezius, we'll look at the origin and then the insertion, and also for the latissimus dorsi, we'll look at the origin and then the insertion of that muscle. Okay, so I said this whole muscle here is the trapezius muscle. Okay, it has three parts. It has the upper part, it has the middle part, and then it has the lower part, or you can say the upper fibers, the middle fibers, and then the lower fibers. So it takes a linear route. Okay, it starts from the skull, okay, specifically the superior nuchal line. Okay, that's where we have the superior nuchal line, okay, and the external occipital protuberance, and then it goes downwards here to the ligamentum nuchae, and then it spans all the way to the spine of the 7th cervical vertebrae here, and then also the spines of all thoracic vertebrae. So this T1, T2, T3 all the way down. Okay, then we'll look at the origin of the latissimus dorsi. Okay, so for the origin of the latissimus dorsi, this structure here is the scapula, and this is the inferior border or the inferior angle of the scapula. So this is where latissimus dorsi originates from. Okay, it starts from the inferior angle of the scapula, goes all the way here across, and then now also takes a linear route. Okay, so it goes down to the lower 6th thoracic spine. Okay, so we have T7, T8, T9, T10, okay, T11, T12. Then it goes all the way down to the thoracolumbar fascia. So this T12. So the subsequent vertebrae are the lumbar vertebrae. Now this whitish thing you see here is the fascia. Okay, the thoracolumbar fascia, and then extends all the way to the iliac crest and the last three ribs. Now for the insertion of the trapezius inserts on the clavicle. So it inserts on the clavicle here, and then the acromion, and then the crest or the spine of the scapula. Okay, so the clavicle, the acromion here, and then the crest of the scapula. And then for the insertion of the latissimus dorsi, okay, it inserts here on the floor of the bicipital groove. Again, let's look at the two superficial muscles, the trapezius muscle and then the latissimus dorsi muscle. For the origin of the trapezius muscle, we said it takes a linear route. It starts from the skull, specifically the superior nuchal line, plus the external occipital protuberance here, and then extends downwards here where we have the ligamentum nuchae, and then downwards to the spine of the 7th cervical vertebrae. okay, and then spans all the way down to the spines of all the thoracic vertebrae. Now, where is the insertion of the trapezius muscle? The insertion of the trapezius muscle are in three areas: the clavicle here, number 2 the acromion, and number 3 the crest or the spine of the scapula. The clavicle, the acromion, and then the crest of the spine. Now let's look at the latissimus dorsi. We said it originates from the inferior angle of the scapula here, goes across and then takes a linear route, so spans the lower 6 thoracic spines from T7 all the way to T12, and then once it gets here, this is where you have the fascia, the thoracolumbar fascia, spans all the way through the thoracolumbar fascia and then goes across the iliac crest together with the last 3 ribs. Now, where does the latissimus dorsi insert? It actually inserts here, the floor of the bicipital groove. So let's look at the nerve supply and action of the trapezius and the latissimus dorsi. Okay, the trapezius muscle is supplied by the spinal accessory nerve, the spinal accessory nerve. Then the latissimus dorsi is supplied by the thoracodorsal nerve. Okay, the trapezius is supplied by the spinal accessory nerve. Latissimus dorsi is supplied by the thoracodorsal nerve. Now let's look at the action of trapezius, the action of trapezius muscle. So I've used this acronym to represent the action of trapezius muscle. So red, R stands for retraction, E stands for elevation, D stands for depression. Okay, again, the action of trapezius muscle, R stands for retraction, E stands for elevation, D stands for depression. Okay, so the upper fibers actually causes the elevation. So we said that the trapezius muscle has 3 layers or 3 fibers, sorry. It has the upper fiber, it has the middle fiber, and it has the lower fiber. So the upper fiber will cause the elevation, okay, then the middle fiber will cause the retraction, and then the lower fibers will cause the depression. All right, so the latissimus dorsi helps in moving the arm, okay, from 90 degrees to 180 degrees together with the serratus anterior muscle if you are moving the arm above the head. Okay, so let's come to the latissimus dorsi. We say it is supplied by the thoracodorsal nerve. Now, the latissimus dorsi belongs to a group of muscles called the scapular motion muscle. Okay, this muscle is able to pull the inferior angle of the scapula in various directions, okay, producing movement of the shoulder joint, such as internal rotation, adduction, and also extension of the arm. Mind you, we said that the latissimus dorsi, in talking about the origin and insertion, we said the origin, it originates from the inferior angle of the scapula. Okay, so let's look at the deep layers. The deep layers, we've already spoken about the superficial layers. We spoke about the trapezius, we spoke about the latissimus dorsi. Now let's look at the deep layers of the back muscle, or the deep muscles. Number 1, we have the levator scapulae muscle. Number 2, we have the rhomboid minor. Number 3, we have the rhomboid major muscle. Now all these muscles originate from the vertebral column, okay, C1, C2, C3, C4 vertebral column, and then it inserts on the medial border of the scapula. See, so this is the medial border. Here we have the medial border of the scapula. Okay, so the first muscle, levator scapulae, actually spans from the superior angle of the scapula all the way to the crest of the spine. Then we have the second muscle, which is the rhomboid minor, okay, just opposite to the crest of the spine. Then we have the rhomboid major, which starts from the crest of the spine all the way to the inferior angle of the scapula. Now for the nerve supply, it is supplied by the dorsal scapular nerve, the dorsal scapular nerve, or nerve to rhomboids. Now the action of the levator scapulae muscle, so the L is levator scapulae, it causes elevation of the scapula. Elevation, just from the name levator, so it elevates, elevation of the scapula. Okay, so this is where you have the levator scapular muscle, so it pulls it upwards and it elevates the scapula. Now the rhomboid minor and then major causes retraction of the shoulder. Okay, it causes retraction of the shoulder, so it moves sideways, right? So these are the actions. These are the actions of the deep muscles. The levator scapular muscle, okay, causes elevation of the scapula. So this is the elevation of the scapula. So this is the action of the levator scapular muscle. Okay, then we have the rhomboid minor and then the rhomboid major, so causing retraction moves backwards, retraction of the scapula. This is also causing retraction of the scapula. So you can see from the action, this elevation of the scapula, this retraction of the scapula. Now there's another muscle called the serratus anterior muscle, which spans the middle part of the axilla. Okay, the anterior part of the axilla, it spans the anterior part of the axilla. Looking at the origin of the serratus anterior, it starts from the first to eighth rib. So this is the first rib, second, third, fourth, fifth, sixth, seventh, eighth rib. Okay, that's the origin of the serratus anterior muscle. Then for the insertion, it inserts on the inner lip of the medial border of the scapula. Okay, so this is the inner lip of the medial border of the scapula. Okay, inner lip of the medial border of the scapula, that's where it inserts. Alright, for the nerve supply, it's supplied by C5, C6, and C7 nerve roots. C5, C6, and C7 nerve root. Now, for the action of the serratus anterior muscle, it causes protraction of the scapula. Protraction of the scapula. Protraction means that you are moving backwards. You are moving the scapula. Protraction means you are moving the scapula forwards. Okay, you are moving the scapula forward, just as you can see in this cartoon what this child is doing. Okay, moving the scapula forwards. That's protraction of the scapula. And also upward rotation of the scapula. Upward rotation of the scapula. So you can see here there's upward rotation of the scapula. So if you rotate the scapula upwards above your head, this is by the help of the serratus anterior muscle. So two things. Serratus anterior muscle originates from the first to the eighth rib. It inserts on the inner lip of the medial border of the scapula here. It is supplied by C5, C6, C7 nerve roots. And then for the action, it causes protraction of the scapula, moving the scapula forwards, and then also upward rotation of the scapula, moving the scapula upwards. Okay, or moving your hands above your head. Okay, so you can see this. There's the action of the trapezius. So action that we have rotation of the scapula above the head from 90 degrees to 180 degrees with trapezius. Okay, so trapezius will move the scapula upwards towards this direction, and then we have the serratus anterior moving the inferior border of the scapula outwards. Okay, so if you want to move your hand above your head, or move your hand from 90 to 180 degrees, you need two muscles, the trapezius muscle and then the serratus anterior muscle. What will the trapezius muscle do? The trapezius muscle will move the scapula above or upwards, and then the serratus anterior muscle will move the scapula outwards. Okay, that is how you would move your hand above your head from 90 to 180 degrees. Mind you, from 0 to 90 degrees is done by separate muscles. Now, paralysis of the serratus anterior muscle can be caused by injury of the long thoracic nerve. Okay, C5, C6, C7. The long thoracic nerve. Okay, it may also occur during breast surgeries. Okay, now deformity or injury to the long thoracic nerve that supplies the serratus anterior may cause winging of the scapula, or what we call a wink scapula. So you can see the scapula protruding outwards. Okay, you can see the scapula protruding outwards. You can see the scapula too protruding outwards. So this is a wing scapula. okay, because there's damage to the long thoracic nerve which supplies the serratus anterior muscle. Now let's look at the muscles of the shoulder. The muscles of the shoulder. Okay, there are 6 muscles. Okay, 6 muscles. Okay, we have the deltoid muscle, we have the teres major muscle, then we have 4 muscles which forms what we call the rotator cuff muscles. Okay, supraspinatus, infraspinatus, and then teres minor, and then subscapularis. Again, there are 6 muscles of the shoulder: deltoid muscle, teres major muscle, and then 4 muscles which form what we call the rotator cuff muscles. Okay, the acronym we use is SITS: supraspinatus, infraspinatus, teres minor, and then subscapularis. So let's look at them one by one. So this is the deltoid muscle. Okay, very, very important muscle, deltoid muscle. Okay, the teres major muscle is not really shown here. Okay, now let's look at the rotator cuff muscle. There's the supraspinatus, infraspinatus, teres minor. All these muscles, supraspinatus, infraspinatus, and then teres minor, inserts on the greater tuberosity. And you can see that the subscapularis, which is the last muscle, inserts on the lesser tuberosity of the humerus. Again, the supraspinatus, the infraspinatus, and then the teres minor muscle all insert on the greater tuberosity. Okay, so you can see that the supraspinatus, it originates from the suprascapular fossa. Okay, suprascapular fossa, and then it inserts on the upper lip of the greater tuberosity of the humerus. Then the infraspinatus also inserts on the middle lip of the greater tuberosity of the humerus, and then the teres minor muscle also inserts on the lower lip of the greater tuberosity of the humerus. Okay, now for the supraspinatus, okay, we said it inserts here, infraspinatus inserts here, teres minor muscle inserts here. So what are rotator cuff muscles? Rotator cuff muscles are muscles which inserts on the greater and then the lesser tuberosities of the humerus. Okay, now it's important to note that for the deltoid and the supraspinatus muscle, these 2 muscles are responsible for abduction between 0 degrees and then 90 degrees, 0 degrees and then 90 degrees. Again, let's go over the muscles of the shoulder. The muscles of the shoulder. There are 6 muscles of the shoulder: the deltoid muscle, the teres major muscle, which starts from here, okay, and then enters here. So it's okay. So that's where it spans the teres major muscle from here all the way here. It's not, the muscle is not shown here. Then the 4 rotator cuff muscles. Okay, supraspinatus, the supraspinatus, this infraspinatus, this teres minor muscle, and this is subscapularis. Okay, supraspinatus, infraspinatus, teres minor, and then subscapularis. Now it's important that we talk about the supraspinatus muscle, even though it's a very small muscle. It's important to note that the supraspinatus muscle originates from the supraspinous fossa and then inserts on the upper impression of the greater tuberosity of the humerus. Okay, it is supplied by the suprascapular nerve, and it's important to note that the supraspinatus initiates abduction from 0 to 15 degrees. It initiates abduction from 0 to 15 degrees. Now let's come to the infraspinatus. It is also supplied by the subscapular nerve. Okay, it inserts on the middle impression of the greater tuberosity. Alright, but it is responsible for lateral rotation, in addition to the teres minor muscle, which also causes lateral rotation. However, the teres minor muscle is supplied by the axillary nerve. Okay, the subscapularis causes adduction and medial rotation. This is supplied by the upper and then lower subscapular nerve. Right. Okay, so let's look at the other 2 muscles of the shoulder, the deltoid muscle and the teres major muscle. Remember, we spoke about the other muscles of the shoulder. We spoke about the 4 rotator cuff muscles. the supraspinatus, infraspinatus, teres minor muscle, and then the subscapularis. Okay, the other two shoulder muscles are the deltoid muscle and then the teres major muscle. Okay, so this is the deltoid muscle. This is the deltoid muscle. The deltoid muscle is supplied by the axillary nerve and is actually responsible for initiating abduction from 15 degrees to 90 degrees. From 15 degrees to 90 degrees. Remember, we said that the supraspinatus muscle initiates abduction from 0 to 15 degrees. Okay, once it gets to 15 degrees, the deltoid will take over and then continue from 15 degrees to 90 degrees. Now, the deltoid, okay, originates from here, the clavicle, the acromion, and the crest of the spine. The clavicle, the acromion, and the crest of the spine, and it inserts on a tuberosity called the deltoid tuberosity. Now it has layers, or it has fibers. This is the middle fiber, this is the posterior fiber. Okay, the middle fiber is the most important. That's what actually initiates the abduction or the abduction from 15 degrees to 90 degrees. The axillary, or the anterior fiber causes flexion and medial rotation. The posterior fiber causes extension and then lateral rotation. Okay, so we'll talk about the other muscle, the teres major muscle. Okay, it spans from the lower third of the lateral border of the scapula. The lower third of the lateral border. So this is the lateral border of the scapula, and this is the lower third. Okay, that's where it originates from, and then it inserts on the lateral lip of the bicipital groove. The lateral lip of the bicipital groove is actually responsible for adduction, adduction, and also medial rotation. Adduction and then medial rotation. So let's look at lesions of the axillary nerve. Okay, paralysis of the deltoid muscle. Remember, we said that the deltoid muscle is supplied by the axillary nerve. Okay, so if we have damage to the axillary nerve, what are some of the likely possibilities? So the causes of lesions or damage to the axillary nerve can be a dislocation of the shoulder. Okay, you can have shoulder dislocation. You can have fracture of the surgical neck of the humerus. Okay, this is the surgical neck of the humerus. Okay, it's actually below the two tuberosities, the greater and the lesser tuberosity. Okay, once you have fracture of the surgical neck, you can injure the axillary nerve. Okay, now what's the deformity? You can have a flat shoulder due to paralysis and atrophy of the deltoid muscle. What it means is that you can have muscle wasting. The muscles can waste and atrophy. So the deltoid muscle, that area can become very flat, to look very, very flat. Okay, so we have flat shoulder due to paralysis and then atrophy of the deltoid muscle. So we'll look at the rotator cuff muscles. The rotator cuff muscles. Remember, we mentioned 4 rotator cuff muscles: the supraspinatus, infraspinatus, teres minor muscle, and then the subscapularis muscle. Okay, so these are the rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and then the subscapularis. Now it's important to note that the stability of the shoulder joint is dependent on the rotator cuff muscle, the integrity of the rotator cuff muscle. Okay, they stabilize the shoulder joint by fixing the head of the humerus in the glenoid cavity. Okay, so these 4 muscles, they stabilize the shoulder joint by fixing the head of the humerus in the glenoid cavity. So let's look at the abduction of the arm. Abduction of the arm. Now it's in several degrees, from 0 to 90 degrees, from 0 to 90 degrees, and also from 90 degrees to 180. From 0 to 90 degrees, and then from 90 degrees to 180. So under 0 to 90 degrees, it is divided into 0 to 15 degrees, and then 15 degrees to 90 degrees. 0 to 15 degrees, and then 15 degrees to 90 degrees. Okay, this degree, we are talking about the degree of movement. Okay, the degree of movement. So movement of the humerus is actually by 2 muscles. Okay, from 0 to 90 degrees, any movement that occurs from 0 to 90 degrees is actually by 2 muscles. The first muscle is the supraspinatus. That is the muscle that will initiate the movement from 0 degrees and then move all the way to 15 degrees. Now once it gets to 15 degrees, the muscle that takes over is a deltoid muscle. It moves the arm from 15 degrees to 90 degrees. Now once it gets to 90 degrees, another group of muscles will take over. Okay, we have the trapezius muscle and the serratus anterior. The trapezius muscle and the serratus anterior muscle. If you remember our previous slide, we said that the trapezius muscle will pull the scapula upwards, and then the serratus anterior muscle, it moves the scapula or the inferior border of the scapula outwards. Okay, if you want to move the hand above your head. Again, for the abduction of the arm, it's in various degrees, from 0 to 90 degrees, and then from 90 degrees to 180 degrees. Okay, so from 0 to 90 degrees is orchestrated by two muscles: supraspinatus muscle, which moves the arm from 0 to 15 degrees, and then the deltoid muscle, which moves the arm from 15 degrees to 90 degrees. Then from 90 degrees to 180, it is done by the trapezius and then the serratus anterior. Trapezius moves the scapula upwards, serratus anterior moves the scapula outwards. Trapezius moves the scapula upwards, serratus anterior moves the scapula outwards. Again, to reiterate the movement, abduction of the arm, okay, from 0 to 90 degrees, and then from 90 degrees to 180 degrees. Okay, we said that from 0 to 15 degrees, from 0 to 15 degrees, that is orchestrated by the supraspinatus muscle. And then from 15 degrees to 90 degrees is by the middle fibers of the deltoid muscle. Okay, and then from 90 degrees to 180 is orchestrated by two muscles, the trapezius muscle and the serratus anterior muscle. Okay, so this is the trapezius muscle to move the scapula upwards, and then the serratus anterior muscle moves the scapula outwards. So trapezius is upwards, serratus is outwards. Okay, again, from 0 to 15 degrees by the supraspinatus, then 15 degrees to 90 degrees by the middle fibers of the deltoid, and then 90 degrees to 180 by the trapezius muscle and serratus anterior muscle. Now, there are some spaces between the muscles of the shoulder joint. Between the muscles of the shoulder, there are some spaces. Okay, there are two main spaces: the quadrangular space and the triangular space. Quadrangular space and the triangular space. We have one quadrangular space and two triangular spaces. Okay, so you can look at this schematic diagram here. Okay, so this is the humerus, this is the teres minor, this is the teres major, and this is the long head of the triceps. Okay, this is the quadrangular space, this is the triangular space 1, this is triangular space 2. Okay, so you can follow. This is the humerus, this is the teres minor, this is the teres major, and this is the long head of the triceps. Okay, so this space here is the quadrangular space, here is the triangular space 1, and this is the triangular space 2. You can also look at it here. Okay, so this is the humerus. Okay, so this black line is the humerus, this is the teres minor, the red line is the teres minor, the green line is the teres major, and the blue line is the long head of the triceps. Okay, so this space here is the quadrangular space, this is the triangular space 1, and this is triangular space 2. So for the quadrangular space, okay, it has important vessels going through it. It has the axillary nerve and also the posterior circumflex humeral artery going through this quadrangular space. Okay, then when you come here, triangular space 1, we have the circumflex scapular artery, and then when you come to triangular space 2, we have the radial nerve, going through it. Okay, now again, we said that there are spaces, okay, found between the muscles of the shoulder. We have one quadrangular space and two triangular spaces. Okay, so this is the humerus. Okay, we have the teres. Okay, we have the teres minor, teres major. We have the long head of the triceps, right? This quadrangular space 1, triangular space 1, and then triangular space 2. Okay, so this is the humerus, this is the teres minor, this is the teres major, This is the long head of the biceps. So this the quadrangular space, this triangular space 1, triangular space 2. So for the quadrangular space, we say we have the axillary nerve and then the posterior circumflex humeral artery going through it. Then for the triangular space 1, okay, we have the circumflex scapular artery, and then for triangular space 2, we have the radial nerve and also the profunda brachii artery. So guys, if you've learned a thing or two from this tutorial, kindly like, share and subscribe to my channel. Best wishes, and I'll see you in the next video.